Most of us are aware that there are PAs in several countries around the world, not just the US. But have you ever wondered what the PA profession is actually like in those other countries? Is their scope of practice the same as ours? Are they able to come to the US and sit for the NCCPA exam and become a US PA? Or are we able to go to their country and work? These are the kind of questions that I would love to know. I think that you're going to be surprised at the scope of practice that they have in India and at their training. I'm excited to have the first interview in that series of interviews with a PA who's trained and worked in India. So please help me welcome her to the channel. Welcome, Anita. Thank you so much for joining us today.
Thank you, Michelle. It's an absolute pleasure for me to be at the Medicine Couch. I've been following your Medicine Couch for quite some time, and it feels really surreal for me to be here. I'm super excited, and let's do this.
Well, I am excited too, because I want to learn about the PA profession in India, and I know you can give us some great insight into that. Why don't you give us a little just overview of your career in India?
Yes, I am a cardiothoracic surgery trained PA from the southern part of India. I graduated in 2004 from India's first PA program that happened to be started in my native city in Chennai. I graduated in 2004 and have been a cardiothoracic PA ever since. I was so passionate about cardiac surgery that I completely buried myself in cardiac surgery all through.
And I found that when I interview people, there are some people that they have a specialty that's them through and through, and then other people have changed a lot. I'm curious, I'm kind of jumping ahead a little bit, but in India, is it possible, like it is in the US, for PAs to change different specialties?
There is a possibility. Having said that, it's more surgeon, like physician specific, because if the physician feels that he can train a PA in his specialty, though the PA is from a different specialty, that is possible, because there are no standardized practice in India. So it is possible to actually switch specialties as well. But most of the PAs that I found don't seem to do that, because they become really specialized in their area of work and they kind of rise up the hierarchy over a period of time, and they really don't want to completely boycott all of that and start something really new. That's like in a very rare circumstances, but it is possible. Yeah.
Okay. So kind of going back to the beginning, do you know, you said you were in the very first class of PAs in all of India? Is that what you were saying?
The program was the first program in India, but we were not the first batch. We were probably the 10th or 11th batch. So there were a lot of PA students that passed out before us. So we were kind of at a stage when the bachelor's degree was becoming more popular. So initially, the PA program started in India as a master's course. It was started by a cardiac surgeon named Dr. K.M. Cherian, who actually worked at the University of Alabama. He saw PAs firsthand here, saw that they are quite a handful, how efficient and integral they are to the healthcare system in the US. And when he returned back to India and established his own practice, he wanted to model that PA system to India. And what he did was he collaborated with one of the top universities in India, which is called the Birla Institute of Science and Technology. And he started the PA program. It was a private institution. It was a private university. It was like a one-off course that was started. And it slowly but steadily became very popular as PAs kind of rolled out and started practicing in different areas within the hospital. It was initially within the institution for the local needs of the institution. And then with word of mouth, people started acknowledging the true value and the worth of this kind of a cadre in a healthcare system. So then it kind of mushroomed across the length and breadth of the country. And what started as institutionalized PA program, which was more cardiac oriented because it was started in an Institute of Cardiovascular Diseases, then it became a more generalist model, and PAs now are trained to be working in every specialty across the country.
Are the clinical rotations, like in the US, there are certain core rotations that you have to have, and then there's a few electives. Is that pretty much how it's done in India, or is it just select ones?
In India, it is quite different in the sense that the PA students are exposed to clinical rotations right from day one of the course. So we are posted in different departments in the hospital right from day one. So the first year consists of postings in the basic medical sciences, laboratory, and all of that. Second year, it is in the OPD, the ICU, and all of that. Third year, it is in the OR, in more sophisticated, like the specialist ICUs and all of that. The last year, the final year, which we call as the internship, is the elective. So that is 1 year. All of the elective rotations are all completed within the third year, and your chosen area of specialty where you get exclusively trained is in the last year. So that's the clinical year. Once the PA student graduates, the PA student is actually quite comprehensively trained in that area of specialty. The PA student is the most efficient resource from day one of employment.
How is the profession progressing in India right now? Like, do you have any numbers, like how many PAs exist and how many programs exist?
I probably would have approximate numbers. Probably there are around 6,000 PAs across the country. I know it's like grossly less in comparison to the US. Last week, I saw a post that said NCCPA certified the 200,000 PA recently. I was like, oh, wow, that's like humongous. So it is gaining popularity, to be honest. There are a lot of surgeons and physicians asking for the PA. So the demand is increasing because the awareness is increasing. And the PA colleges are increasing as well. There are a total of around 90 institutions across the country that is offering the PA course. There are 19 to 20 universities totally, but they tie up with different hospitals across the country. So the institutions are around 90 that are offering the PA course. So students are actually spoiled for choices, to be honest. It's picking up. It's slowly, but definitely picking up.
That sounds great. U.S. profession had to start from scratch as well with just a little bit of time growing. So that sounds fabulous. Do you have to get like a kind of state or province or whatever they call it? There's a licensed practice medicine there?
That remains to be seen. As of now, the Ministry of Health has promised us that every graduate would get a licensing number, as is in the US. So every allied health specialist, not only a PA, every person from other profession as well will get a licensed number to be able to practice. Having said that, we are not sure if that will get translated into state licensures as well, as is the practice in the US. That remains to be seen.
And then how about like the NCCPA here? We have an exam that everyone has to pass, the PANTS exam, when you are graduating to prove that you have got all the knowledge. Do you have something like that in India, a national exam yet?
Not yet. But I think it will be in place in due course of time, because the courses, as I said, are variable, though the curriculum should be standardized after the council comes into place. But to prove that there is a national standard that is being maintained, perhaps an examination may come into effect.
And so sounds like your training is actually a bit more involved than the US. And I assume that you're fairly familiar with the scope of practice that PAs have in the US, correct? How do you think the scope of practice for PAs in India compares to the US scope of practice?
It's quite different because the practice in India presently is more physician specific and institution specific. So a PA can be allowed to do, there are no specific directives or specific listed out jobs that a PA can do or cannot do presently. So it all depends on the trust a physician has, the rapport that you share, and how much a physician is willing to delegate to his PA, his or her PA. To put things in perspective, there are many of us in our respective hospitals that actually do pretty much more than what USPA does, because we in the OR are very commonly used to putting the patients on the heart-lung machine, what we call as cardiopulmonary bypass. So it's my daily job to open the chest, put the patient on cardiopulmonary bypass to arrest the heart and prepare. And then the surgeon steps in like for just 45 minutes for the exact main procedure, after which I again take over. I wean the patient from cardiopulmonary bypass, do the decannulation, then hemostasis closure, everything is on me. So I'm there from skin to skin, and the surgeon steps in right for the main part of the surgery. And what happened was last year, I was actually fortunate to be involved in the APA CVS cardiac surgery first assistant boot camp. So to put things in perspective, last year, I got exposed to a lot of USPA students when I was the faculty for the cardiac surgery first assistant boot camp that the APA CVS conducted. I was then the international board member of APA CVS. That was a great initiative from APA CVS as well. I really need to congratulate to them for being so innovative and inclusive. And I happened to be the first international board member for APA CVS. So they invited me over for the annual conference, and I interacted with all of these PA students, and I told them that I do all of this on a daily basis. They were like flabbergasted. They were like, how in the world are you able to do all of this? That's not permitted here in the US. So the scope of practice in India seems to be much more than what we do. Well, because there is no standardization, there is no scope of practice that is listed, there is no legislation attached to it. It is variable and it is according to the surgeon's comfort. I said it's because these are perils and perks of not having the standardization. So these are perhaps the perks of not having the government recognition and all of the directives in place. So they, in fact, few of the USPAs were asking if they could come to India to practice, to be able to do all of this. That is very nice. So the scope of practice is different. Of course, I'm not saying that again is the norm in India, that there are a lot of PAs in India who do not do all of this. To be honest, in my case as well, what I was doing in one institution, I was not allowed to do in another institution because that surgeon was not comfortable in me doing those things. So it's variable in India, but on an average, at least in the OR, Indian PAs actually perform a lot more than the US.
You mentioned that US PAs asked if they can practice over in India. Is that possible? Can PAs who are licensed in the US take their license and go over and apply to work in India?
Currently, it is possible because there are no barriers. There are no regulatory barriers for not being able to practice. If the physician and the institution are convinced that this is a PA that is well trained from a good institution in the US and can contribute in a productive way to my practice, they can employ the PA from the US.
Okay.
But that may change once the council is in place. We don't know if the council will set directives like the PA from international PAs should be able to clear an examination to be able to practice in India. That is something for the future, but as of now, there are no barriers.
Yeah. Do you feel like that there's good reception from most physicians and other people in healthcare to the PA profession there in India?
It's better now. It was not so earlier when we all started. It was really, we went through a phase of identity crisis because people didn't know who a PA is. All they knew was PA as personal assistants. They never considered us clinicians. We had to literally prove ourselves in every new job, in every place, what we are. I'm not a doctor. I'm not a nurse, I'm not a tech, I'm a PA. So how do you explain to them? Only by way of our work. That was really a daunting task for many of us, but it's much better now. The awareness is better among the medical community. So the respect also is much better.
Trust me, I mean, even here in the US, and profession's been going on since the mid-60s. When I tell people that I'm a PA, usually if they work in medicine, they know what a PA is. But if you talk to just the general public and somebody says you're a PA, they're like, oh, are you a public accountant? Are you a personal assistant? Or are you a whatever?
Oh my God. I'm appalled to hear that in the US. Oh, there is no general public awareness in India because the awareness is gaining in the medical community. I'm not sure how the general public awareness is. I'm sure all of our families and our extended families would know, all of the PA students and their families, etc. But I don't know if a lay public person would recognize what a physician assistant profession is. I think for that, we have a long way to go. But I'm appalled that that's like a grappling issue in the US in current times.
Yeah, the IAPA, what is that organization called?
It's Indian Association of Physician Assistants. Just like the IAPA, which is a national body in America.
There's like an international PA association where people, different countries can work together or something. Is that true? Or?
International Association of Physician Associate Educators. It's called IAPAE.
That's cool. I didn't even realize that there's an international association, and it makes sense because as the profession grows around the world, we do need to be kind of standardized and to work out all of the things like we talked about. Will PAs be able to work in other countries or get licensed and things? So talking about that, we talked about PAs going from the US to India, and that's possible. What about Indian trained PAs? Can they come to the US and work, or can they get licensed at all?
That's the Achilles heel for an Indian PA right now.
Okay.
So the short answer to your question is yes and no. I'll tell you why. So you got to come to the US, complete your prerequisite course. Most of the prerequisite courses are covered in our undergrad, but there are a few, like 2 or 3, which needs to be completed at a local institution. So you got to complete your prerequisite courses and then apply for the master's, repeat the PA training here, repeat the PA course, and then sit for the NCCPA examination and then you can practice in the US. So yes, the answer to your question is yes, if you go through all of this. No,
Right.
if you use only your PA degree from India to come and practice in the US, you cannot.
So let's talk a little bit. I'm curious, and I think probably other people are curious about just the healthcare system in general in India. In the US, there's problems with our healthcare system, and a lot of people are disillusioned with the fact that we spend so much money on healthcare, but our numbers don't back that up as far as where we rank in the world for different things. I'm just kind of curious if you don't mind kind of telling us how India's healthcare system is set up. Is there socialized medicine? Is there private insurance? Is there a mixture of both? How does that work?
That's an interesting question. India has a multi-payer universal healthcare model that is paid for by a combination of private and public health insurance funds, along with an element of almost entirely tax-funded public hospitals. In India, the public healthcare delivery system focuses more on affordability and accessibility, of course, along with quality care. I know in the US, the main focus is on patient satisfaction, better outcomes, and all of that. But in India, the main difference is there are many primary health centers and sub-centers that, in fact, lack essential infrastructure and medical equipments and resources, making it difficult to even provide basic healthcare services to that population. In the cities, it is different. In the premier cities, you can match the international standards. India has become the medical tourism hub. People from Europe, Ukraine, Russia, Middle East, they all flock to India to get the treatment done. So in the primary cities, it is world-class technology and standard. But in stark contrast to the three-tier and rural areas in India, the medical health system is quite lacking. So there is a lot of variability, and affordability and accessibility is a huge issue.
In the US, medicine has become a huge, big business. And as providers, we get pushed to see more and more patients because we're bringing in the money. Does that happen in India? Do you feel like that you guys have the same kind of pressures as we do?
Yeah, we're working in corporate hospitals, so there's always a pressure for numbers. That's exactly what I meant when I said a lot of clinical decision makings are actually based on a lot of other factors rather than the patient-specific factors. So these are not well talked about, but it does exist. And a lot of physicians are under pressure from the management to generate that much revenue. So they have to show those numbers every month to be able to satisfy the management. So yeah, it does exist.
So I imagine that burnout is an issue there in India for clinicians as well, like it is in the US.
It is. It's a sketchy bridge. It is something that people are not very vocal about. But yes, there is the burnout issues are looming large, definitely.
Okay, well, anything else that you want to say about the PA profession in India and your thoughts on it?
Well, one thing that I would again want to highlight is the PA course in India, the PA training in India is very strong. It is very comprehensive, exhaustive, and it is very complete. It may be different from the US model because it is 2 years after your any bachelor degree, it is 2 years of master's degree, but here it's a 4 years of comprehensive, complete training. But the standards are the same. As you said, there has to be two-way traffic. People from here, if that's their choice, need to be able to go and work over there, and people from India should be able to come and work over here. So I hope things open out a bit more and the US system is a bit more inclusive of Indian PAs. And as we spoke of, if PAs can go through the examination PANSE and be able to practice in India, that would augur very well. And at a stage of like global integration that we are all talking about, it seems more prudent to be able to have this kind of two-way traffic.
I'm excited to see how the PA profession grows around the world, and hopefully we become kind of one cohesive profession and get some movement around the world. Thank you so much, Anita, for sharing with us your experiences in India and helping us learn a little bit more about our profession around the world.
Thank you, Michelle. It's been my absolute pleasure. Thank you for having me.
Great stuff from Anita, and I love hearing about how the PA profession is developing around the world. And I really do hope that somehow we can standardize the profession and that we can lift up the profession all around the world. I put some videos here that may interest you about PAs working around the world, but you also can go to my main channel page and check out my playlist to find the topics and the videos that are interesting to you. Thank you so much for joining me today. And as always, take care, stay sane, and I'll see you next time on the Medicine Couch. Bye.